This 1-minute test could save your life, yet so many women still avoid it. So the pap smear is a test that gives us information about the cells of the cervix. It can detect abnormal cells, precancerous cells, and precancerous lesions on the cervix. While the human papillomavirus test, the HPV DNA test, identifies any aggressive, high-risk HPV strains that are present on the cervix. These two tests together give us a wealth of information about a woman's cervical health and her risk stratification. Routine screenings are important, and they should also be age appropriate. So the first screen that a woman should get in her youth, once she becomes sexually active, is an STI panel. That's your sexually transmitted infections panel. Once becoming sexually active, you should be getting your STI panel done. The next screen that you should be getting at age 40 is your breast cancer screening with a mammogram or a breast ultrasound for those with dense breasts. This begins at age 40, but in certain high-risk groups, you may be screened earlier, depending on what your doctor says. At age 45, women should be getting their colon cancer screening. This is your colonoscopy. That's done every 5 or so years. After that, you should be thinking about your bone mineral density test at age 55, which is also done about every 5 years. Other tests that you should be routinely going to your doctor's offices for, especially after the age of 30, are your regular blood pressure screening, your diabetes screening, and your cholesterol screening. When we think about women, we think about the whole picture. Our bones, our breasts, our sexual infection status, and our cervical health status. So the human papillomavirus vaccine, or HPV vaccine, is the first powerful tool in the HPV prevention toolkit. This vaccine protects your body against high-risk aggressive forms of the human papillomavirus, which is a sexually transmitted virus. So human papillomavirus causes cervical cancer. This vaccine fights and protects you against human papillomavirus. Who can get the HPV vaccine? Everyone. Boys and girls. It's best started at about age 9 before sexual initiation, but there is still benefit in persons up to age 45. Ask your care provider about the HPV vaccine. So lifestyle factors that can increase your risk of cervical cancer is sexual exposure. So any modifications that we can make, like reducing the amount of sexual partners we have, or exposure to a partner that has multiple partners, because this also increases their risk of getting human papillomavirus. Smoking also increases your risk of cervical cancer because it decreases your body's defenses of fighting human papillomavirus. Other things that we can do to decrease our risk is by living a healthy lifestyle, eating nutritious food, exercising, because these things can increase and improve your immune system. As I mentioned, stop smoking, and practice safe sex. Many women in Jamaica delay or avoid screening because of fear. That's the truth. Either fear of perceived discomfort from the test or fear of getting a bad result. Some women delay doing it because of misinformation, which is very dangerous. They either feel that they don't need the smear or the smear is not for them. Other persons delay or avoid testing just because of lack of prioritization. As women, we're always busy doing other things and taking care of everyone else. We can change the mindset around cervical cancer by normalizing healthy, accurate information about it and making sure that women feel respected and supported in their care.